Dr. Lou, tell us a little bit about children. What should moms who just had a baby, what should they do at home? When should they bring the child to the dentist? What should they take care of? What should they not do? Is there some advice you can give parents with their children?
Yes. The parents, once the child or baby starts showing teeth, you can bring them to the dentist right away so we can take a look and see if there's any problems. And after that, we would tell you what needs to be done on home care for the child's teeth. Generally, when kids are younger, we tell the parents that they need to brush their child's teeth to the age of at least 6 to 8 years old, depending if the child can brush their own teeth correctly.
Okay. What else does a mom have to do? First of all, let's go back. Like when a mom brings in a child, when the teeth start coming, obviously you don't have any work to do there, right? This is just to for all purpose, basically to check and maybe get the child comfortable with the doctor. Does that help?
Yes, that definitely helps to bring them into the setting. What we generally tell parents is how to do home care. Basically, take any cotton or something to wipe their child's tooth after each feeding. We generally tell parents don't leave the bottle in their child's mouth overnight because that would cause something what we call baby bottle syndrome, where it's really easy to get cavities because the teeth are coated with milk, presumably, and that has sugar in it, and that will cause cavities very easily.
Well, I can see why. I can see why, because that's the opposite of. I mean, we learned that we're supposed to brush after every meal, possibly, but at least at night. And that would be the opposite. You're soaking it in the milk. Because even if the milk has no sugar in it, like you didn't put any additional sugar, the milk is sweet by itself. It has sugar. It turns acidic and all that stuff, right?
That's totally correct, and that's what we need to educate parents too, and how to take care of their child's teeth, because sometimes the child, once they get comfortable drinking milk before they sleep, and they like to leave it in their mouth or something like that, but actually that's very detrimental to their teeth.
Mm-hmm. Yeah. What about having the lollipop in it for too long or thumb sucking? Is that a bad thing? And is there something parents could maybe do to avoid it if it is a bad thing, rather than being antisocial? But are there any effects for the teeth also, or something else?
Yes, we tell parents if they can to try to prevent their kids from thumb sucking. Probably the biggest detriment that thumb sucking will cause their child's teeth to shift, to move, and then eventually the child will need to do braces. Because what they're doing is when they suck on their thumb, it causes a negative pressure, which causes them to change how their mouth forms. So that will cause the teeth to be either crowded or problems that will usually need braces to fix.
I see. And what can parents do to make the child not sucking the thumb if the kid is doing it? There's a lot of ways. It depends what works. I know some parents, or we tell parents, maybe put something that's sour on their thumb or spicy. Or there's appliances where they can't suck their thumbs, or anything that generally works. There's so many ways out there. It depends on the child and how it works. But you need to get it early, because once the child starts thumb sucking for extended period of time, it's very, very difficult to stop them from doing it. What about just talking to them? Just tell them, look, this is just not nice, or it's not healthy, or it's not whatever. Whatever. I mean, at different ages, children understand different things. But just talking to them and gently removing it with their hand and be vigilant about that. You have found that to be helpful?
It depends on the child, but most of the time, the reason why they suck on their thumbs is for comfort, and it's very hard to to tell the child don't suck their thumb, because usually if they're in a situation where they're stressed or something, they put their thumb in the mouth. It comforts them. It reminds them of, if there's any breastfeeding involved, they're with mom or something. So usually when we try to tell them, they're too young to really understand. All they understand is comfort. So usually the other methods usually work better.
Okay. Well, wonderful. Thank you very much. Letting us know when, children should go to a dentist, and what I like the bottle things, not because I think that's one which could easily perhaps be overseen. Out of comfort, you let the baby fall asleep, and then there he or she is there, sucks away, sleeps away, and you go, wow, this is wonderful. And then so what should a person do? Should they fill it with water or something if a child feels comfy falling asleep with it?
Well, one thing is try not to feed them or let the bottle stay in their mouth the whole night. And after they feed them, they generally just try to wipe their teeth, or like you said, maybe give them some water to drink with it, just so it kind of washes away that coat of milk or something on their teeth that can cause cavities.
Okay. Well, thank you very much, Dr. Liu.
Thank you. My pleasure.